Pranams to His Holiness. I welcome all of you for the sixth day of Breastfeeding Week 2024. So we, JSS Institute of Naturopathy and Yogic Sciences, are very happy to see that our previous sessions have empowered new mothers and the students with valuable knowledge that our doctors have given on nutrition, government schemes and support, and also about the milk banks. So today we are taking it a step further by tackling a crucial aspect of breastfeeding, that overcoming diversity. That is coping up with the maternal and infants health issues. Here we have an eminent speaker today with us, Dr. Preeti, lecturer come medical officer in JSS Institute of Naturopathy and Yogic Sciences, Coimbatore, heading the Department of Forensic Medicine and Pathology. So we welcome Dr. Preeti to deliver her valuable insight. Over to you, Dr. Preeti.
Thank you so much, ma'am, for the warm welcome. Yeah, thank you so much, ma'am, for the warm welcome. Also, I thank JSS Management Principal Dr. Dilip sir for providing me an opportunity to give a speech, one of the speech during the Breastfeed Awareness Week released by World Health Organization. So we have reached the second last day of this Breastfeeding Awareness Day. And this day, I'm going to speak about the breastfeeding through adversity. So coping with maternal and infant health issues. So we, in this speech or in this talk, we will be understanding the beautifulness or the understanding of breastfeeding, and we will little bit more in deeper understanding of maternal health issues and infant health issues, as well as and identifying ways to address them or to cope them. So we have been understanding through the previous classes or previous breastfeeding awareness week about importance of breastfeeding. Breastfeeding has been considered much importance, and yes, World Health Organization have given an striking theme this year, that is closing the gap and breastfeeding support for all. So they have identified that there have been still existing a gap in awareness of breastfeeding, importance of breastfeeding for mother as well as for the infants, and what are all the challenges faced by the breastfeeding mothers. There is a gap in understanding, and there is a gap in identifying what are the measures which can be adapted to address them. So there is still existing gap. So that support has to be filled. So the information regarding everything has to be provided. So that support should be provided for all. So breastfeeding is recognized globally as the optimum method for feeding the infants due to its numerous health benefits for both the mother and the child. So World Health Organization along with UNICEF has been doing so many in-depth programs and awareness activities and resources has been released throughout their web to bring the importance of breastfeeding. So why breastfeeding? So breastfeeding has got so many benefits to the mother as well as to the infant. So one of the best one is the nutritional benefit. It provides the ideal nutrition for the infants with a perfect balance of the vitamins, proteins, and fats that is necessary for the baby's development. So the breast milk has got the perfect balanced volume of vitamins, proteins, and fat that is, of course, going to be in need for the baby's development. And it is also an easily digestible formula, the composition, which contains antibodies too, which helps the infants to fight off the viruses as well as the bacteria. So the basic immunity also has been acquired through nutritional benefits. Next is the health benefits for infants. So infants, it reduces the sudden infant death syndrome. The mainly there has been identified cause of sudden infant death syndrome as the infants not getting appropriate breastfeeding. So this reduces the risk of SIDS, also reduces, so lowers the likelihood of developing conditions like type 1 diabetes, celiac and Crohn's diseases. So these are all the endocrine as well as diseases related to the intestine. And also, uh, proper breastfeeding is associated with higher IQ scores in later childhood. So it also is having very good effect on cognitive development of the baby as well. What is a health benefit for mothers? So how it is breastfeeding is going to benefit a mother? But through breastfeeding, it reduces the risk of breast as well as ovarian cancer. So breastfeeding is also a normal physiology, a normal thing, like as digestion is happening in our body, as normal blood circulation is happening in our body. Even lactation is also a normal physiology. If normal physiology are allowed to go in their uniform manner, it helps in reducing dangerous diseases. Also, it helps in faster the postpartum recovery. So, what are all the experiences, the blues, the depression, or any physical or mental aspects after the delivery, the female experiences during the lactation? The lactation helps to makes it faster to overcome those things. Also, the postpartum bleeding. Next is it aids in weight loss, that is natural weight loss after the childbirth. So lactation has beneficial is equally beneficial for the infant as well as for the mothers. So lactation has got even psychosocial benefit too. So it has got an immense activity or immense strengthening of the bond between the mother and the baby. So the bond has to be created, and the strengthening of the bond is aided by lactation. Also, it promotes an emotional security and reduces the levels of stress. So here is a detailed explanation about benefit of a breastfeeding. Why we are speaking about breastfeeding? Why it is necessary? What is it for? Why does it has to be proclaimed or awareness has to be created? So we can see in a varied parameters like nutritional balance for infants. The ideal nutrient, the balanced nutrients for growth is received through lactation. The antibodies also one of the component is received for the infants through lactation. So SIDS, diabetes, obesity prevention, and in mothers, the breast and ovarian cancer prevention or reduction can be observed. So the IQ development is seen among infants by lactation. Then the post-mortem recovery and weight management is seen beneficial for mothers and bonding. So the emotional security with the mother and the mother-child bond is being elevated by breastfeeding. So now we have understood the breastfeeding, why it is very necessary. Let's now try to understand what are all the health issues where a mother can be observing or mother can be experienced out of breastfeeding. So the first one is low milk supply. Sometimes feeding mothers face certain difficulties like low milk supply. Why it happens? It happens because of poor latching. Latching is correctly the baby or the infant is suckling the nipple of the mother and getting the proper lactation. If the proper suckling of the nipple doesn't happen, the normal physiology of milk production will be disturbed. Next causes infrequent feedings. If there is a difficulty or the frequency of feeding or shortening the period of shortening the duration of lactation also results in low milk supply. Maternal stress or illness. If the mother is experiencing heavy amount of stress or any physical illness, that might result in low milk supply. Next is use of certain medications. Certain medications also can result in low milk supply. So, what are the probable coping strategies that can be done to prevent this low milk supply? First one is So we have to identify, or we have to resolve the causes. So one of the cause was infrequency. So we have to frequently, that is at least 8 to 12 times in 24 hours, to stimulate the milk production, to maintain the milk production. 8 to 12 times is recommended. Next is proper latch has to be ensured by the mother. Always before during the lactation, the mother has to take care that the latching, the baby is properly suckling the nipple properly. So correct latching is has to be ensured by the mother. Next is breast compression. If at all, if there is a problem with the output of milk, breast compression devices can be used. Pumps can be used. Next is staying hydrated and well nourished. Yes, it is not, it is a very necessary that not during pregnancy or during delivery, even after delivery, proper nourishment has to be taken care by even mother also. Staying hydrated, staying nourished, drinking plenty of fluids, and having a balanced diet is very vital. Next is not always, never ever try to resolve issues by our own. Always we need to be in touch with our family physician, our lactation consultant, a person who is having experienced knowledge, authentic experienced knowledge in the background, has to be what is a consulted to get a proper professional advice. So use of galactogogues. So galactogogues are the natural or there are even synthetic ones, but adding galactogogues like natural galactogogues like fenugreeks, cluster beans, jeera, as well as drumstick leaves in our diet. They are having proper function of improving the milk production in females. So that is one of the maternal health issue. Next one is nipple pain. This is one of the issue which is being faced by most of the mothers. The causes can be incorrect latch. Again, if the infant is not latching properly, nipple thrush. Nipple thrush is an infectious condition where the nipple and areolar region, that is the region surrounding the nipple, can be observed to be reddened or flaky or whitish. This is because of some infectious manifestation. So that has to be addressed by a doctor itself. Next is engorgement. So engorgement of the breast is one can be resulting in nipple pain. If there is engorgement of the breast and resulting engorgement of the areola as well as the nipple, also causes what is a nipple pain. Next is tongue tie or lip tie in baby. Tongue tie or lip tie is a developmental defect where it is seen in infant where the frenulum is a connection between the lower palate as well as the tongue. If there is no proper development, the tongue movement is restricted in infant. So this restriction will result in improper latching and nipple pain in females. So this is one of the maternal health issues. So what are the solutions is, again we have to correct. Mother always have to make sure the latch is correct, the latching is properly done. Nipple care. So nipple thrush has to be addressed by using certain ointment like lanolin to soothe the areas and also to soothe the sore nipples. So basically, these ointments can be applied, and before next lactation, that has to be properly wiped off and cleaned properly before next lactation. Next is air dye. Immediately after lactation, proper air drying has to be done, and make sure that there is no wet. So wet invites the microbes and funguses. So that can be one of the reason for developing of infection. So air dry has to be done. Next is adjusting feeding positions. So the feeding positions has to be adjusted so that the pressure on the sore areas can be reduced. Sometimes because of continuous lactations, continuous pressure can cause sore in certain areolar area. So if the positions are changed accordingly, that sore area pressure can be reduced. Because if Again and again in a same position and same pressure will cause ulceration in that sore area. So to prevent that, express milk, so breast pump can be used. So if at all, if you need a break in the lactation, pump can be used and the milk can be given through a bottle. Next is street infection. Again, self-treatment should not be done. A proper, authentic, experienced healthcare provider should be approached and the proper medications should be taken for infections. So, and assess for tongue tie. So, if there is any tongue tie, we have to assess the infant. So, raise the tongue, elevate the tongue a little bit up and check whether the any developmental issues there with the frenulum or not. So, these are all the probable solutions that can be addressed to prevent the nipple pain. Next is postpartum depression. Postpartum depression, when I was going through about the postpartum depression, uh, apart from the nipple pain and the low milk supply, postpartum depression was given or was identified to be more incident one, where the cases of postpartum depression has been identified more, and there has been every country has been releasing so many awareness websites, awareness resources, so many awareness helplines. So there were toll-free helpline numbers exhibited upon their website whenever the mother is feeling this postpartum depression. So postpartum depression is very important, and addressing a postpartum depression as well as people who are surrounding a mother who is experiencing postpartum depression also should be thoroughly consulted, or what to say, counseling has to be done. So impact is can because a lady, a mother experiencing postpartum depression impair the ability to breastfeed. And we have in the initial area of the speech, I have explained about the importance of breastfeed. So if there is an inability of the breastfeed, there it is going to affect negatively for the infant as well as for the mother. And there will be lack of motivation, lack of energy, lack of focus. So what are all are the experiences? What are all the things which are experienced by a postpartum, what I say, a mother is that there will be sadness, hopelessness, severe mood swings will be there. There will be high amount of irritability, anger will be there, anxiety will be there. Sometimes in the night, panic attacks can be there. Sometimes the mother can feel so much of guilty, inadequacy. Sometimes the mother might feel difficulty in bonding with the child. So some of the physical symptoms like very fatigue, feeling of so much lethargy, changes in appetite. Sometimes the mother will feel so much of hungry. Sometimes they will not feel to eat at all. Their sleep is disturbed a lot. So insomnia will be experienced by the postpartum depression women. Unexplained ache or pain. Sometimes in an unexpected area, there may be aching or paining. And with the behavior also, they will feel so much anger, anxiety, they will feel to withdraw from the family and friends. They will not be able to take a proper decision. They will not be able to do a proper concentration. There will be thoughts, disturbing thoughts, which might will be harming oneself, or sometimes there will be thoughts that might be ending up resulting hurting the baby. So these are all the symptoms which has been experienced, and why it happens, what are all the causes, why postpartum depression happens. So there are a few of the causes they have identified. One of the causes hormonal changes. So yes, once the female experiences a menstruation, during the ovulation, how and all the hormones takes a roller coaster ride. Similar roller coaster ride of estrogen and progesterone levels can be seen after the childbirth too. Okay, and changes in the thyroid hormones also can be observed in mothers, where feeling of depression is mainly rooted because of this thyroid level. So next is one of the causes emotional factors like stress being from carrying of a newborn. Now I have to take care of a newborn. Now a baby came. How will I be able to take care of this baby? Will I be able to be a proper mother? Like that, emotional feelings will be there. Then next is after delivery is not a simple thing. Giving birth to a baby is a very what to say, I don't know how to explain that. Though the mothers who have given birth to babies might understand. Delivery, pregnancy is not easy. So, after completing a period of pregnancy, a period of delivery, the mother will have so much of rushing of feelings within them. That will be there. Then after delivery, the suture pains, the low back aches, all these things will be there. Sometimes, if the psychosocial factor is also one of the cause for postpartum depression, where there is lack of support from family or friends, or if the mother is anxious about the financial stress, or if there is history of, if already the mother was persisting with any history of depression, mental health disorders, or any stressful event, these can be a probable causes of postpartum depression. So, how we can identify with all the symptoms which I have mentioned before, we can identify a postpartum depression, and also there is Edinburgh postnatal depression scale. So that is a scale which evaluate all the level questions will be there at all the levels, and we can identify whether the mother in postpartum depression. So coming to the treatment aspect, so coming to the self care, before self care strategies, I personally suggest, after reading all these things, rather than going into a self-care, immediately approaching again a counseling psychiatrist, a counseling psychologist has to be given more importance. So a counseling psychologist will be knowing certain treatment like cognitive behavior therapy, interpersonal therapy, supportive counseling. So they are all very well expert in that area. So those experts will be providing you that much support. So cognitive behavioral therapy is one which will help you to modify your thoughts, change your negative thoughts into a positive thoughts. Interpersonal therapy is where it involves husband and wife, the mother and the father, sitting together, and also how a father is also equally responsive for the what is a mental health aspect of a female, supportive counseling. So these and all are the things which can be provided by a doctor, okay, by a psychiatrist to you. And also, depending upon the condition, doctor might be providing you certain antidepressants as well as hormonal therapy to control your symptoms. Coming to the self-care strategies, regular physical activity. Yes, physical activities might be finding it difficult, but yes, physical activity plays a much important in improving our mood as well as regulating the stress. Adequate rest. Do not involve in too much of thoughts, too much of physical activity. Yes, you have undergone a normal physiology which made you tired. And yes, a tired equals rest. How much tired you are, that much amount of rest is must for you. So the sleep, the rest has to be prioritized. Next is healthy diet. Yes, for your health, for your infant health, for your mental health, balanced meals plays an important role. Next is stress management. So mindfulness, yoga, relaxation. So we Bachelor of Naturopathy Yoga professionals are very much trained in the area of yoga, mindfulness, and relaxation exercises. You can approach a naturopathy and yoga physicians in addressing your stress management through mindfulness and through yoga, as well as giving you a counseling on healthy diet too. Next is supportive growth. Do not always think that you are alone in this. There are so many supportive growth groups of new mothers where we can sit together and talk your things. So, what and all are your experiences? What and all are their experiences? How they coped there, or how they overcome those difficulties and all. When we talk, a group is sitting together and talking will be more, and so it will be more kind of we will understand, and we will understand that we are not alone in this. Yes, we have a community and we can overcome this. So there are online and in-person supportive groups which are helpful in this aspect. So psychotherapy, as already said, we have to, so you can see here a supportive doctor who is very well established, knowledge person. So cognitive behavior therapy, interpersonal therapy, supportive counselings are the one which are done by them. Next is social and economic stresses. Yes, of course, the female will have the social anxiety, the economic stress, the financial stress, thinking about the maternity leave, the lack of maternity leave, inadequate supportive systems, okay, and financial pressures. So these also causes. So these stressors have to be identified. And yes, those who are hearing this, I am very sure that both male and female will be hearing. That means human being, that is even our students. So the boys and girls also be hearing. So boys also have got very much role in overcoming the maternal health issues, because mothers maternal need a support system. Okay, support system in the sense identifying you are not alone in this. We are there. The issues can be solved together, this can be solved. So that support, if it is there, of course the female can come out of this postpartum depression. So postpartum depression, so postpartum support, international as well as national agencies and websites and resources are out there which will really help you out in that. So these are all the few common maternal health issues which I found relevant. So the nipple pain, low milk supply, and majorly postpartum depression. So now coming over to understanding infant health issues. So infant health issues, premature birth. Yes, coming to a premature birth. Premature birth is a preterm baby where a baby is born before 37 weeks of gestation. 37 weeks of gestation. So we have classified preterm birth where late, moderately, very late, and extremely preterm birth. That is less than 28 weeks if the baby is born. That is an extreme premature birth. So premature birth is also showing so much of prevalence, like 1 in 10 babies are globally preterm babies or premature birth. So premature infants, why premature infants health is concerned? Yes, because they will have difficulty in latching, suckling due to underdeveloped reflexes. So their reflexes are not developed. So sucking and latching will be very important for them. So uh, coming to the what are all the factors why premature birth is happening? Why preterm deliveries are happening? One thing is maternal health conditions. So infections like urinary tract infections or amniotic fluid infections or any chronic conditions if the mother was having like high eclampsia, preeclampsia, diabetes, problem with the uterus, cervix, placenta. So all the health related conditions sometimes end up in premature delivery of the baby. Next is pregnancy related factors. So multiple pregnancies, triplets, there was a previous preterm birth also, or short interval between the pregnancies. These might result in premature delivery of the baby. Lifestyle factors. If the mother was indulged in unhealthy lifestyle like smoking, alcohol, drug abuse, poor nutrition, higher levels of stress can result in premature birth. Then maternal age is below 17 or over 35, there are chances of this. And low socioeconomic status and prenatal care, lack of prenatal care is also adding on to it. So, lack of premature. So now let's understand what are all the symptoms. Okay, so preterm birth symptoms are the mother will experience regular contractions or tightening of the abdomen. There might be sometimes severe low back ache or abdominal ache, like a heavy menstrual cramp, how it is that ache might be there. There can be altered changes in the vaginal secretion. Sometimes secretions of watery, sometimes mucus-like, or sometimes blood-stained secretions can be observed. There can be heavy pelvic pressure which have been observed. So these are all the symptoms of a premature delivery. So if a premature delivery is there, infants are most prone to get not only that latching and reflexes alone. Sometimes infants might undergo something called as respiratory distress syndrome. So there may be surfactant. So common people might be difficult to understand what is surfactant. So surfactant is the one which maintains a pressure and normal structure. If there is no surfactant, the lungs will collapse. So there will be no maintenance of the structure, collapse will be there. So that proper movement of inhalation, exhalation will be disturbed here. The premature baby will find dyspnea, that is difficulty in breathing. Sometimes premature birth, so patent ductus arteriosus is a premature, which is a anatomical derangement pathology where it will be altering the blood flow within the infant. Sometimes the infant will be showing reduced blood pressure. Sometimes there can be intraventricular hemorrhage, bleeding within the brain can be observed in prematurely birthed babies. Even yesterday, in yesterday's talk also, we have identified something called as necrotizing enterocolitis. So necrotizing enterocolitis is a GI disturbance seen in premature birth babies, and feeding difficulties will be there. Their immune system will be highly compromised. Their immune system. So these are all the difficulties of infant will face if there is a premature birth. So going to immediate, so if at all, if there is a premature birth, again, you should not go into a self-care strategy. Immediate care of course, if we are delivering the baby in a hospital, immediately the baby will be transferred to NICU, the neonatal intensive care unit, and proper treatment will be provided. Breathing support, the proper nutritional support, the proper monitoring, preventing of infections, and all the support will be provided. So that has to be properly done. Do not feel like my baby is in NICU and do not get involved in mental stress. So in NICU, the baby will be provided in all support, that is proper nutrition, development, the everything, the health will be monitored, everything will be there. So how we can prevent that? So why don't we enter in before entering into these many problems? If we have got a prevention strategy, why don't we do that? So regular prenatal care. So during the pregnancy, constantly having a visit to the hospital and monitoring all the signs of pregnancy, the scans and the test and everything which has to be done, and getting proper advice from the doctor has to be done. Of course, healthy lifestyle, which has been constantly, I'm repeating from the slide 1 till, and probably I'll be explaining it till the last slide too. Managing chronic conditions like diabetes, high blood pressure has to be done, and stress should be reduced. So these are all the prevention strategies which has to be adopted to prevent a premature birth. Next is low birth weight. Next infant issue is low birth weight. So low birth weight is defined as baby weighing less than 2,500 grams. Okay, so extremely low birth weight is seen where if the infant weight is below 1,000 grams. So that is very dangerous and very important condition that has to be allopathy attention needed one. So low birth weight is similar to preterm infants, and low birth face difficulties in even breastfeeding too. So yeah, coming to why a baby have low birth weight, or why the baby is less weight. So first one is maternal health and lifestyle. Again, coming on to the health and lifestyle. So conditions, any pre-existing conditions or unhealthy lifestyles like nutrition, smoking, which has been explained further, will be causing a low birth weight in the infants. Next is pregnancy-related factors. So again, triplets, twins, placental issues, eclampsia, preeclampsia, low previous history of low birth weight also causes pregnancy related. So is adding on to the low birth weight. Socio-economic factors. So increased stress, very less access to the healthcare, low socio-economic status can result in low birth weight. Next is genetic disorders or exposure to environmental toxins can also result in low birth weight. So, babies' immediate health challenges will be there. So, same like premature birth baby, all the respiratory issues, the body temperature issues, getting prone to infections will be experienced by a low birth weight child also. So, long-term health risk is also there for them because their development of cardiovascular system and respiratory system is also in a question. So, that will be there. So, management and care, immediate medical care, of course, immediate medical care is necessary. So, baby will be transferred to the NICU and all the temperature, breathing, nutritional support will be provided. Monitoring and following up, regular health checkups after the delivery also, baby's health should be follow up and check should be done. Parental support. So, parental support is educational and emotional support to the parents is necessary because seeing the baby they might end up in feeling of low self esteem of course can be there. So parents also should be provided with the appropriate support. Again, when we have a prevention way, if we address the prevention strategies, we can prevent the low birth weight babies. So prenatal care, healthy lifestyle, chronic conditions, stress and education, of course, helps in prevention of low birth weight. So this all strategy. So infant health mainly I could observe was the premature as well as low birth weight, which can be most important stress has to be given on the prevention aspect. So next is sometimes after the birth, sometimes the baby might experience health conditions like jaundice and can get interfere with the breastfeeding. So these also shall be or has to be addressed by a experienced physician correctly. No self-care strategy should be done. Please do not rely on to informations from some people or random informations and do not apply. Always approach a professional persons to get a cure or coping strategies. So coming over to this, so I have gone through breastfeeding, importance of breastfeeding, maternal health issues like low milk supply and nipple pain and postpartum hemorrhage, not hemorrhage, depression, as well as addressing infant health issues like premature birth and low birth weight. So the most important takeaway message from my awareness speech is that persistence and seeking help. So never hesitate for a professional guidance. Always seek help because you are not born with the knowledge of everything. So, if at all, if you are feeling low or feeling doubted, seek help immediately. Encouragement and empowerment. Empower mothers with knowledge and support. Encourage them to trust their instinct and seek help whenever needed. That encouragement and empowerment, because mothers should not be felt alone or felt in a low esteem condition. Support resources. There are so many. So the 2 days back, one of the speech of our best awareness speech was the schemes which are available from the government for the mothers. Okay, there are so many schemes which are supportive for the mothers. Seek that support, get it done, approach them properly. So that will help us in overcoming all the health issues as well. So that's all for my. So we have got our breastfeeding awareness week has been beautifully designed to address each and every problems as well as benefits equally. So I request all our viewers and our students to go through the speeches from day 1 to day 7 to get a comprehensive understanding on the breastfeeding. So that's all from my side. I thank each one of you for listening to me. Thank you. Thank you so much.
Thank you, Dr. Preeti, for your enlightening talk. Your expertise and passion have inspired us to tackle adversity and support breastfeeding successful. So we appreciate your time and dedication to improve maternal and infants' health. Thank you, Doctor. I thank the management and the principal for this wonderful opportunity. So we, JSS Institute of Naturopathy and Yogic Sciences, signing out for today, and stay tuned with us for the upcoming useful topic tomorrow by 11:30 a.m. Thank you.